Hello, and welcome to the Surgical Assistant Podcast, a podcast crafted by surgical assistants for surgical assistants, where professionalism meets passion. Hello, everybody, and welcome back to our podcast. Tonight, we're doing a spotlight for education, and we're interviewing the Externship Coordinator and the Lab Director of Meridian Institute for Surgical Assisting. So I'm John.
I'm Kelly. Hi, everybody.
Hey, Kelly. Great. So I guess we'll start with Shannon, who's the lab director. Do you want to just tell us a bit about yourself?
Hi, my name's Shannon Smith. I'm the lab director. I've been full-time with Meridian since October of 2023. Been part of their team as an adjunct instructor since 2017. Been in the operating room since 1989. Started out as a surgical technologist and worked in a hospital setting, of course, and then began assisting and got my certification in 1999 as a CSFA. Been first assist in a private setting in Georgia at a smaller practice for a period of time, about 15 years. And then got into education in about 2009 and have taught surgical technology and surgical assisting since then in some capacity while still working in the field. Worked in Evansville, Indiana for a large surgical practice and enjoyed that very much. And then moved to Nashville and went back to Florida and now on to Nashville. So just
Well,
staying with the
welcome.
profession.
We're
Wonderful.
very glad to have
Hey.
you, Shannon. Thank you.
Thank-
Candace, do you want to tell us a little bit about yourself?
Yeah, I'm Candice Spencer. I'm the clinical externship coordinator at Meridian. So I went through a surgical technology program in Bowling Green, Kentucky, graduated in 2009. I ended up working at the Medical Center of Bowling Green for 13 years. And in that time frame, I actually went through Meridian and graduated. So I'm a graduate as well. And I graduated in 2015, assisted for a few years. And then in February of 2020, I was asked if I wanted to come down to Meridian and work. And I said, absolutely. So I've been down there ever since doing the externship stuff. So it's really awesome knowing that I had went through externship myself. So I think that gives me a leg up being the coordinator.
Oh,
Yeah,
that's
you know what
wonderful.
these students are going through and the questions they're going to ask and the challenges they face too. And it's interesting. I'm looking forward to talking to you, both of you, but you, Candace, because I do see on a lot of our Facebook forums and social media forums, I see a lot of questions about externship and clinicals and just a lot of people saying, can I do my clinical cases while I travel? And so we're going to address some of those things and get some answers from you. And I'm looking forward to clearing some of that up for our listeners. Yeah.
Absolutely. Yeah.
That's great. Thanks. I guess we'll kick off the first question to Shannon. Do you know how long Meridian's been around or that program's been
It's-
open and running?
It's been up and running since about 1998. So it's going on 27 years now. So
That's
been around for just a
fantastic.
minute.
All right. I don't know if we mentioned it is in Nashville, Tennessee. I mean, you both mentioned
Yeah.
moving to Nashville. So it is in Nashville. And you don't have to live in Nashville to attend and go through the program. I did not. I'm in Florida now, but I lived in Alabama when I went through the programs. They make it easy. You don't have to be local or anything like that.
Right.
All right.
That's right. Yes, maybe you could just give us a brief rundown then of the program. I know that you have to apply and then there's a didactic phase. And do you want to just give us a brief rundown?
Yeah. So we offer two programs. We offer the certificate program, the SFA online program, and then we offer an associate in applied science for surgical assisting. So students must complete the certificate program before they can apply for the associate's portion of the program. But in order to be eligible for admissions, they need to be a graduate of a KHEP or an APHES accredited surgical technology program, have a minimum of 1 year scrub experience, and currently be working in the scrub role. Program is 12 months in length.
Mhm.
We run from 12 months consecutively for completion of that program. So students can use financial aid for our program as well.
Oh, wonderful.
And then we admit each month, we start a new class each month. So we have a starting class each month. We've got 50 students, maximum capacity that we enroll each month.
50 students each month?
Yeah.
Great. What's
So
the
one of the
total-
things that I would like to say, if I don't mind, is because one of the things that I see often is students, they apply and then they're anxious to get started and they think they can start the very next month. And There's, obviously an admissions process. So once their application is accepted, there's other documentation and things that have to be submitted, and they have to go through kind of all of that. So, it takes a little bit of time to get through that. And of course, depending on how quickly the student responds and provides the requested documentation, that could delay their start time.
Wonderful. So once a student is accepted into the program, then how long is the SFA certificate program?
The certificate program is 12 months. Yes, 12 months in length.
And there's a didactic requirement, correct?
Yes. So we have 12 modules or 12 courses that we have them go through. So some of those, the beginning courses, the first 2 to 3, I think it's the first 3 courses are about 8 weeks in length. Then starting with the 4th course, they're either 3 or 4 weeks in length. So once they start with the program, then we get them scheduled in for lab. We like to have them come into the lab within their first 6 months of being in the program. The earlier, the better, because they have to get through that lab component and check up on those skills in order to be clear for their externship portion. So they do the didactic portion, and then they complete their lab week in Nashville. So as you mentioned, everything is online with all of the didactic work. The only thing they're required to do is to come to Nashville for 1 week for the hands-on skills.
Wonderful. And then in order to do their clinical externships, they have to attend the lab portion first, correct? And once you're passed on that, you have an exam, correct?
Correct. Which we do an anatomy review early on, and we do a lot of different types of review on just anatomy, and we do some general surgical assisting review and things like that. And then we get them into the lab for 3 days of their full-time hands-on in the live tissue lab and working with them on learning new skills, honing some skills that maybe they've already picked up with their experience in the operating room, and then making sure that, they're competent so that we can clear them so that they can go out and represent Meridian. And of course, obviously be safe patient care, obviously is the point there, but they do have to pass those lab skills check off before they're cleared for externship, in addition to some other things that Candace needs in order to get them cleared for externship.
Yeah, I was just about to say they in addition to the lab week, which our students are given plenty of opportunity and plenty of time to turn information in for me. But basically, they do have to have a clinical site in mind, and it's generally a place that they currently work at. You mentioned traveling, Kelly. Our travelers don't have an issue with using their current clinical site that they're traveling at in order to gain permission, establish relationships with preceptors who are going to be the surgeons or CSFAs or CSAs who have been certified for 3 years. Those are the acceptable preceptors for our program. And they have to get malpractice insurance, which all that is outlined to them. Have just now started using a digital platform for recording cases, so no more paper. I know you guys are pretty bummed about that. I know.
No more blue pens.
Me too. I know. Me too. Yeah. Yeah. So we've moved to a digital platform, which has been super smooth, super easy as far as the transition goes. And I get them into our digital platform a month before they even start. So they start getting all that information into me and start, with the questions and inquiring about things and all that kind of stuff. So we try to get it all out there before any kind of problems arise or anything like that. All that information is out there.
I will interject here that I remember, and I applied and was accepted into the program in 2012 and graduated in 2013. And then a few years later, Shannon, when they started, the first year they started the degree program, I took advantage and jumped right into that and did that the first year that was available. But I will say that I remember, and one reason I speak so highly of this program is that I felt so prepared. Like they started telling us from the beginning what we were going to need well ahead of time. And so that was great, because it is a lot and it can be overwhelming to think about all the things you need, but they really had us prepared from day one, letting us know what the expectations were. So I see that's still a priority and it's still something that's going on there. Good.
Right. As far as clinical placement goes, we do have a few facilities who have reached out to us and say, can you get our information out there? We're looking for people, that sort of thing. So if somebody's struggling with a clinical site, I tell them, you may need to relocate. to Nashville or to wherever these places are. I think we have a few in Virginia. Some people have reached out wanting students. So I provide that information to them and say, hey, these are the facilities. If you choose to use that as an option, then of course, you can partake in that. So,
Okay. All right. So that
That's
widens
wonderful.
their opportunities there and the potential. And that's always the advice I give to travelers too. It depends on
Mhm.
the facility you're at and the relationships that you're forming.
Mhm.
There's so much importance on the relationship that we have with our surgeons and coworkers anyways, right? But when you're in a
Right.
student role, especially, you want to, really focus on that and form those relationships and there's no reason why a facility that you're traveling at couldn't, sign up and have you proctored while you're working there. So, yeah, that's good. Good to know.
You make a good point. The rapport is everything. And so sometimes from time to time, I'll see on a social media post where someone will say, well, your school should find your clinical site for you. And I always interject and say, you have to remember that you're working under the direction and supervision of these surgeons. These preceptors are signing off on you. And it's important to have a rapport. They have to be confident in your ability because they're taking responsibility for you. It makes a difference to have
Yeah.
those connections to be able
Yeah.
to do that.
Yeah. It's
It sure
critical, in
does.
fact. And you're right. It's not like, and it's unique. This profession is unique in that we are directly under the surgeon and
Mhm.
you've got to have, they've got to know who they're working with, to proctor and be
Right.
responsible for you and your studentship. So that is true. And I'm glad that Candace, you mentioned
Great.
about that because one of the questions that I thought of when I was reviewing these outlines and what kind of questions we were going to ask was the facility liaison. So you might not have, I don't know, you might have specific liaisons in certain facilities, but you definitely have specific facilities that reach out to you and say, hey, we're available. We're available.
Absolutely. Absolutely. All the
All
time.
right.
All the time. So we keep their information. I actually print out their emails and I just kind of, cipher through and give those out to people when they need them. We also have partnered with a group. They're a travel group and they're based out of Florida and Virginia right now, but they're hoping to branch out a little bit more. And that would be very exciting for both them and
Mhm.
us, American surgical
Mhm.
professionals. So we
Mhm.
throw them out there as well
Mhm.
as their name and they're already affiliated with facilities who are affiliated with us.
Right.
So pretty much they
Wonderful.
hire them on and get them their hours for CST and then plus provide them more ample opportunity to get their
Okay.
cases for our program.
Right.
They know the ins and outs of our program, how it works. Me and the owner of that group, we work very well, very close together.
Mhm.
So we work pretty close.
Great.
So, and I know you mentioned affiliations, and I
Mhm.
was trying to get you somewhat of a total because, of course, we are nationwide.
Mhm.
So we have lots of affiliations with lots of facilities, including Alaska and Hawaii. I was trying to total them up. I would say on average, we probably have about 8,000 to 8,500
Wow.
schools that we're affiliated with nationwide. And I always tell people that, but I'm like, we get new ones all the time. You would be surprised how many hundreds of new affiliations we do every
Wow.
year. Students, just word of mouth and coming to conferences and finding out about us. And then I have meetings with their facility and they're like, we want to know what you're about. And we've never had a CSFA before. So
Mhm.
can you have a meeting with us and kind of tell us what it is that you all do and, what your program is about? So I have those meetings and, we really push for our students to be able to branch out and further their education.
That's
Nice.
wonderful. I do have a question
Good.
for you, Candace, while you're talking about the affiliation agreements. One thing we had done a previous podcast and some information that I had put out, the way I understand it, about the affiliation agreements with the hospital, because I was working at a hospital when I applied to Meridian and I wanted to find out about the affiliation agreement. And I was told by Meridian that, oh, we've already had a student that went through at your hospital and the affiliation agreement is evergreen until somebody cancels it. Is that still the case? Okay.
A lot of ours are auto renewal. So they pretty much just keep on going forever and ever unless one party terminates it or another. Now, if they use our affiliation agreement, there is a term there. It's
Mhm.
generally about 2 years or 4 years. So it just depends on if they use our agreement or if they use their own. And theirs is usually pretty standard. pretty straightforward just because they want to, if it's a good experience with the student that they have, then they want to continue that opportunity for all their employees. And when I tell them that, especially when I have those meetings with them, I'm like, you are making a really great investment because you can have them both as a CST or a CSFA. They can scrub, they can pass. I mean, it just opens up more opportunities for everybody as a whole.
Yeah.
It's wonderful. Now, when it gets back quickly to the program, the cases that are required, how many cases are required for the student to fulfill the course requirements?
So the total amount we require is 140 cases total. That's 20 general and then 120 in various specialties. I know when you guys probably came through, when I came through, it was totally different. But yeah, we keep up with the times and with the accreditation standards. So right now it's 20 general and then 120 in various specialties. And I always tell my students the 120 various specialties can also include general. So some students seem to think that when they meet that minimum 20 general case requirement that they can't do any more general cases, but they can always do more general cases. They'll just fall under a different category. And this is based off of our accrediting body. So they pretty much set the standard and then we just abide by it.
Wonderful. What's the typical amount of time it takes a student to acquire those cases?
The typical amount of time, like when Shannon said, when they sign up for the program and then they're given a lab date to choose from, and they basically just choose when the week that they do come to lab. If I ever get a hold of them before that happens, I always tell them to sign up for lab as soon as possible. Just because that allows you the most time and opportunity in order for you to get your cases done. I'm like, you get your lab out of the way, then you can hit the ground running and you can start. Typically, my students take, because it's about 10 months for their externship, because they sign up for lab about 2 months in and it's a 12-month program. So about 10 months is the average, 9 or 10 months. I've had students get done and they're absolute rock stars. I've had them get done in 3 months. I tell them, I'm like, it just really all depends on how dedicated you are to get these cases done.
Wonderful. What's the thing that you think sets Meridian apart from other surgical assisting programs? Not that one's better or, than another, but just what unique things set Meridian apart, do you think?
I think definitely the hands-on lab. It is like no other. That is, of course, in Kentucky, there's another online program, Madisonville, and I was choosing between there or Meridian, and of course, cost was kind of a deciding factor. Even though Madisonville was a little bit cheaper, Meridian was a little bit on the higher side. But when I heard about the pig lab, I was like, I will travel to Nashville, Tennessee to do that pig lab. So I really and truly think that's what sets us apart, and that's what everybody wants to experience when they come here.
Do you want to tell us a little bit about that? How many days are students operating on pigs and how many cases do they do on those pigs?
I'll let Shannon do that.
The students come to lab. They're in Nashville 5 days. We're in the classroom doing some review on Mondays and Tuesdays, going over anatomy review, learning to tie, instrument tie, 1-hand, 2-hand tie, some tie passing techniques, things like that to get them ready for their days back with live tissue, which is Wednesday, Thursday, and Friday. So we take them through a series of procedures. We rotate, we work in groups of 3. So they have the opportunity to work as the surgeon, the first assist, and the second assistant. And one of the things that I stress with them and the lab instructors, we have some great lab instructors that I work with, but we stress the fact that we want them, when they are in that second assist role, to think about things that they can do to facilitate the procedure from a second assistant, not from the scrub role, because we live that every day. They're there as a tech student typically. So we want you not to think about that, but think about what you can do to kind of facilitate the procedure from that second assist role. So we rotate them through each of those roles during the procedures and give them an opportunity to kind of move in and out of the surgeon role so they can really appreciate firsthand, to think about, I'm the surgeon in this moment. What is it that would help me if my assistant would pick up here or place a retractor here? So it kind of helps, I think, lend a little bit of an insight as to what they need to do in that first assist role. So they get to learn quite a bit. They dissecting the tissue, going through the procedures themselves, and not just so much about, of course, it's all an anatomy review, but learning how to skeletonize tissue and blunt dissection and the importance of, the dynamics and the ergonomics of body mechanics and
Mhm.
how you can steady yourself better and make it, less stressful on yourself, making it, more safe for you. Because obviously we know how taxing this role can be over a number of years working in the OR, we're getting some precarious positions. But thinking about all of those things, thinking outside of the box a little bit. So we take them through different procedures and different techniques and get to do some dexterity things, try to make it a little fun and innovative. And then we usually finish out on Friday with what we call our plastics workshop, where we take them through. We focus, even though they're suturing and tying, obviously, the other days, but on Friday, we spend several hours where we're just doing all of those, suturing techniques, kind of really hone in on those, things that they'll need.
Mm-hmm.
That's wonderful. That's one thing that I was blown away when I got to Meridian from my surgical skills lab is just reminded me it's set up exactly like an operating room. I mean, you have for the laparoscopic cases, you have cameras and it's just like a regular OR. You have all the
Right.
instrumentation, all the drapes. I mean, it was really, really mind blowing for me and such a big help to actually work on real bleeding tissue because like you, Candace, I was looking at other programs when I was looking to become an SA, and there were other programs out there, but then some of them were going to hotels and working on surgical foam. And I thought, well, I'd rather spend a little bit more and go to Meridian, which now that we're talking about it, do you have a total cost for the Meridian program, or does that vary?
For the SFA program,
Yes.
I didn't pull the numbers for the associate program, but it's $8,745 is the total for the online certificate program.
Okay.
Yeah.
And you mentioned
And that can always change.
true.
Mhm.
Just keep that in mind.
Oh, that's
Mhm.
true because
Yeah,
it
but
was different
that's
when I went through. Yeah.
right. That's current pricing right now for tuition.
But you said that it's federal student loans and grants are
Yes.
possible with that. That's wonderful.
Yes. Yes.
Excellent.
And it's interesting because we're seeing more and more students that are coming through. Their employers are paying for them because they want them. Speaking to what Candace said earlier about it, the employers being interested in having people that can function with two different credentials. We're seeing more employers that are sending their CSTs through because they want them to get the education and training and move them into the CSFA role. So that's been exciting.
That's
Yeah.
wonderful. Yeah, there were a
Yes.
few people in my class like that, and I was so jealous because I had to pay for it all myself. But that was how much I wanted it. Kelly, are there any questions you can think of that we missed so
So,
far?
I'm going to throw Shannon a curveball because I know she can
Uh-oh.
handle it.
Okay.
You
Okay.
said, and this is another $64,000 question that comes up a lot on social media. And I have to answer it when I answer someone, or in person. If I answer someone, I have to answer them based on my experience. So we're going to go back to 2012. I heard you say that it is a requirement of admission to have a CST. Is that correct?
Not a CST, but they have to be a graduate of a surgical technology program that
Okay.
is either KHEP or ABHES accredited. We
Oh.
prefer that they are a CST, but there are still, a lot of techs out there that aren't certified. But if they graduated from a KHEP or an ABHES accredited surgical technology program, they have at least 1 year of experience in the operating room, and they are currently working in the scrub role because that's
Okay.
important.
Mhm.
Because they have to be working in that role to establish some relationships to get those clinical cases down.
Right. Right. Okay.
Yeah,
Well, my
honesty is a
situation,
requirement.
so I don't know if that's changed or not, but I have a little caveat, and I'm bringing this up because there might be somebody in this niche position. So you can say, no, that's changed. If you were applying today, Kelly, you wouldn't get in. In 2012, I did not go through a surgical technology program. I was actually trained on the job by a absolutely phenomenal CST who was fantastic. I was in Alabama. There was no requirement, and I never went to school. What I did have under my belt was a lot of a nursing school program. So I had a lot of those nursing school prerequisites. Now, do you feel like I slipped in under a radar, or how did that work for me?
No, we've recently changed our admission criteria based on industry standard. And what we're seeing, we do have nurses that occasionally will come through our program. Sometimes they want to go the RNFA route. Sometimes they want to do the RN but be a CSFA. So we do
Okay.
have RNs that do apply to the program, but they must be working in the operating room and must have experience in the scrub role to qualify.
Okay, and
So
so then I was scrubbing, I had been scrubbing, and I was currently in a full-time scrub role, and I just wondered when I hear people say, "Oh, no, you have to be a CST or you have to have gone through a surgical technology program," I just have often wondered, well, I wonder if they changed that or did I, just kind of fit a different criteria, for instance,
right,
so back then.
it has changed within the last year. Our admission criteria has changed.
Okay,
So
so if I know an RN in the operating room that wants to go through a first assisting program and they haven't been through a surgical technology program, are they then not,
they would
eligible?
not they would not have to have been a graduate of a surgical technology program, but they would have to be working in the operating room and have current scrub experience,
Scrub experience.
have at least 2 years and currently have access to the scrub role to
Okay,
be
well, good. Well, that's gonna
eligible for
answer okay,
admission.
well,
So,
all right, perfect. That's gonna clear up some questions then. Good. I'm glad I
yeah.
asked that. Okay.
I don't know if you wanted to talk about any of the organizations or pass rates or anything along those lines.
Yeah,
We're
definitely.
really proud of our pass rate. The national average on the MBSTSA's website, what they're reporting for their most current up-to-date information, which is for 23, is the national average of 71.2%. And we're coming in right under 90%. So we're very,
Oh,
very
nice.
proud of that.
Mhm.
Candace and I both spend a good amount of time during the lab week talking about preparation for their CSFA exams. Now, because we're KHIP accredited, KHIP requires that we use the CSFA exam through the MBSTSA as our outcome assessment
Okay.
exam. So our students are required to sit for that exam at graduation. However, if they want to sit for the CSA credential through the NCCSA, they can certainly do that. Um, as well as we all know, with the legislation and things that have passed thus far, the credentials are synonymous and, are fluid across all of that
Right.
legislation. So they don't have to have both credentials. And actually, I had one student about not long after I came on with Meridian full time that contacted me that had already passed the CSFA exam. She's in Virginia, as a matter of fact.
Mm.
But her facility wanted her to also sit for the CSA exam. And I was like, well, why is that? And they're like, because it's available. They want me to have both. So they were paying for her to sit for that exam as well. So we do have them sit for the CSFA exam. And Candace and I spend a good bit of time in those first 2 days when we're kind of going through their orientation and taking them through some things about their lab week and externship to try to prepare them and give them some ideas and tips and tricks on studying and things like that. So we're very proud of that. That's a great pass rate. So we're proud of that.
That is
Good. Yep.
fantastic. And the way I
Excellent.
remember it,
So,
it was a requirement in order to graduate Meridian, you had to have a date already set for your
yeah.
exam. Okay.
Mhm.
Yes, that still is true. So, and that leads it back to what you were asking Canvas. We use Canvas as a learning management system, not to be confused with Candace. But when you asked Candace a little while ago about, what sets Meridian apart, and
Mhm.
I think it's, goes back to, this is part of it, is like the dedication and the the buy-in of the instructors and of the staff, with our students and in the fact that we're so invested in their success. Meridian's had a wonderful reputation. It's been the industry leader for surgical assisting for a long time. And we continue to try to do, everything we can to ensure that our students are successful. So, in addition to having a live tissue lab, which speaks for itself, it's that buy-in from the staff and the faculty, with our students and the fact that we're just so invested in their being successful. I think that's really, it's not just a pay us your money and go about your way. We kind of walk with them through the whole process.
Yeah, absolutely, and that was my
Yeah.
experience, I know for
Mhm.
sure, so we can
Yeah.
attest to that.
Yeah, mine as well. I did not feel like I was on my own at all. While I was on
Mm-mm.
my own
Right.
doing my clinicals and stuff, I always felt fully supported by Meridian. If I had a question, Deborah Clout was the externship coordinator then. I could always email her and she always had an answer for me right away. And then even when it came to the surgical skills lab, I mean, there were so many people teaching and everybody was very helpful. And I think there were a little extra people in my class because there were 4 of us on a pig for most of them, but
Yeah.
everybody made sure that everybody got a chance to do everything. Oh, you haven't done an
Mhm.
anastomosis here, do this one or
Right.
finish that.
Mhm.
Or so that's one thing I remember about it. It was just, I felt fully supported and people were behind me and I just didn't feel like I was hanging out in the wind at all. So,
Well, it's just refreshing because even our academic dean, he's got a lot of administrative things that he's responsible for, Roy Zacharias. But he, is always back popping his head in the lab. His door's always open. So it's just because he's, the academic dean doesn't mean if a student doesn't have a question or needs some assistance, he would have time for them. Greg Salmon's our director for the AS program. He's available. Everybody's available to our students. And when the students get back in the lab for those 3 hands-on lab days, our lab instructors are wonderful. They just put a lot of time and effort into the students' learning. And they're not going to let you get away with just kind of getting it half done. If your line doesn't look good enough, we're going to cut out. We're going to do it again. And that's important. It's not just that we're just checking a box. We want you're out representing not just yourself as a student, but you're representing us. And so we want to be able to say that we put out a good product, if you will.
Right.
So we take our time and we try our best. So.
Oh, that's
Excellent.
fantastic.
That's so good to hear. And we can model that as former Meridian students. We can model that then in the career, right? We model that what we were given when we were learning, then I can show that to somebody else and support someone else in their education. And even residents. I work with residents, surgical residents, and helping them. And I have had them take that stitch out and redo it. It's not, if I'm the FA on this case, that's not good enough for me. So we got to take it out and do it again. So it's a great thing to be able to just cycle that around, right? And
well, I think it's important that we have to remember that, you're talking about working with a resident and you think about the hierarchy of things and you think, gosh, I'm the first assist, and the, surgeon and the resident's here and I'm here in the hierarchy of things, but we're all patient advocates. So if it's not in the best interest of our patient and if it's not the best for patient safety, then these are the things that we've got to speak up. So that's good.
We must never underestimate our knowledge and our experience and our skill, because sometimes I've been surprised at the things that I know that the surgical resident doesn't know. And he's got all of these years of education on me. I haven't gone through the academics that he's gone through and put in the time and the money that he has or she has. But there are things that we learn that aren't taught in a book and are taught in school. So we can pass to get back with Candace real quick. I'm a student and I was not able to I've got 125 cases and my 12 months is up. What happens?
So we do offer a one-time 6-month extension that does require an additional fee. Right now it's $250, but that could fluctuate as well. So keep that in mind. But that extension is strictly for externship. So if you need just a little bit of cushion, a little bit of wiggle room in order to finish up those cases, then we're flexible with that.
Okay.
And I like to add on to what Shannon was mentioning about us pushing out high quality and all those types of things. I get a lot of, not kickback, but just some comments sometimes from students when they talk about the types of cases that I'm looking for and the types of cases that I take. And I tell them, I'm like, look, I'm preparing you to sit for a national certification exam that covers a wide variety of material. Okay. You're going to need to broaden your spectrums a little bit. I tell the students to get into every specialty that they possibly can during their externship that's available at their facility. So if you can get into open heart, get into open heart. If you can get into neuro cases, get into neuro cases, ortho, all the genres. OBGYN, robotics. If you know robotics, get in those. Just because that gives you a well-rounded perspective and just gives you a good indicate what to study for, what to brush up on in order to be prepared for the exam. And that's what I tell these students. I'm like, that's why our pass rate is so high for the CSFA exam, is because of what I take and what I accept as far as externship goes. If I accepted 140 lap choles, then I'm not doing my job. So, I really push my students and I hold them to a higher standard. And I think that's why our outcomes are very positive.
And thank you for doing that. John and I are both on that page with you. So I appreciate you doing that. And I will, again, I've stepped in and told students when they're trying to count these little cases, or they count stepping up and closing skin as assisting and counting it as a case. I'm like, no, ma'am. I said, well, you have to work that out with your coordinator.
Thank you.
That's, first of all, not acceptable. It's not acceptable because that's not first assisting the case. I said, but I remember when I went through, they would not have taken that. And that's why I have that view. And of course, now in the real world, I see why we have to do that. So thank you for that. Yes.
Well, thank you for stepping up.
Good information.
I have a final question for you guys. So let's say somebody is about to graduate and they're getting ready to take their exam. Are there any tips or tricks you have, or any like apps that they can use to study with, or study guides that you recommend?
Well, when our students come to lab, and we step back and just say, when our students come to lab and we talk about testing, what I tell them to do is to look at the NBSTSA website. And if they look at the website and if they hover over the CSFA credential, a drop down box will come down and there's a test prep that you can click on. And when you click on that, on the left hand side on the bottom, it'll kind of give the content outline of the exam. So the exam is currently is like the CST exam in that it's 175 questions. About 25 of those have no assigned value. So you're really being graded off of 150. And so it's a 70% pass rate. But those, the content outline, it'll break it down and tell you how many questions are dedicated to each content area. And so I always tell students, what I suggest is looking through that and then just go through it with a highlighter. And if there's things that you don't recognize or it's been a minute that you might need to go back and look at, just because you've been in the field 20 years doesn't mean you don't need to go back and review some of this stuff. Because I can tell you at the point when I graduated as a surgical technologist in 1989 and how we were taught to change a contaminated glove on the sterile field was different by the time I started teaching in 2009. So standards change. And if the hospital's policy is not changing with that, and they're writing test questions based off of reference in textbooks, which they outline on the website as well. They have their references, textbooks that are referenced for writing exam questions. But I tell students to go through that content outline and look at it. You know, there's a portion in there on preparation of grafts and don't just, if you're doing vascular, don't think it's just all about vascular grafts. Get with your buddies that are over there in ortho and that kind of stuff. You know, if it's been a minute since, you know, when we talk about some of the portion of micro could be wound healing, it could be asepsis, it could be sterilization. So if you haven't, you know, thought about your sterilization stuff for a minute, you want to review that. So just going through those things line item, I think is helpful. Definitely. And then I always tell students, you know, in surgery, if the anatomy is skewed and we're not sure what we're dealing with, we start from the known and we go to the unknown. I always tell students what I recommend is start from the unknown and go to the known. So if you're doing cardiac 90% of the time, chances are you know that pretty darn well. So start with something that you don't know because you have no idea what that exam is going to cover. Any of the body systems and disease processes associated with that. So start from the unknown and then also start studying now. Don't wait until, because a lot of times I'll have, because I teach some of the online courses as well too. And so I'll have students that'll say, well, I'm just trying to I just want to get graduated and then I'm going to study. And I'm like, but then you're trying to cram everything in. You know, start studying as you're moving along and just kind of build on that foundation. And before you know it, take it a little bit by little bit. So that's some good, I think are good ideas, but also obviously they offer a practice exam through the NB, but there's a lot of good Quizlets that are out there. Helga Olson, for one, is one that I recommend to students. I'm sure you all are familiar with Helga. She's got a lot that's out there that's been very helpful. And she's actually got her degree in anatomy. So she's a true anatomist. So she's got some really good stuff for advanced anatomy. And there's some other ones that are out there. But again, with Quizlet, I always tell students, if they're not familiar with it, if it doesn't look right, research it because you could get an incorrect answer. It's like Wikipedia. There's nobody checking to make sure all the right information's out there. So human error happens. But those are some things that I recommend to students. And then, of course, like I said, looking at the reference list of textbooks that they use for the MBS CSA exam so that they can go over those things to make sure they're up to par. So
Excellent.
Wonderful. I have
Students don't like my answer when they ask me what to study because, of course, we use for our program, which it could change at any moment, but we use Alexander's Care of the Patient During Surgery. And I tell them, I'm like, I read it cover to cover. And they're like, what? And I'm like, I read it cover to cover.
Yeah.
If I'm very interested in something, I'm going to read and research everything about it. I read it cover to cover, and they're just like, and like, go ahead, you know, when they're at lab, I'm like, go ahead and start now because get it done.
That's funny. Talk about setting the standard high there. Read that.
Can't help it, but I'm an overachiever, I guess.
Hey, there's good information in that book. I can't overstate that. There's excellent information in that book. It's a good book.
I do have two quick questions, and I'll let you guys go.
Sure.
the first one is, do you stress that your students join a membership organization like the ASA or the NSAA?
We do encourage them to join the organization. I give them information, and my part of what we do on Monday for orientation to lab is give them some information on both organizations. And we do encourage them to join and become familiar with their organizations and take advantage of the various resources that are available through those organizations. We want them to become student members and engage, and then obviously become active members after they're graduated, because active involvement obviously just enhances the career field and the profession in general. So we do encourage that. And there's a lot of conferences and workshops and things that are offered through both organizations. And we actually have a joint conference every year in the spring that we do together, which is really great. And then, of course, also letting students know that they can be a member of American College of Surgeons. They can be an affiliate member or associate member through the American College of Surgeons, which gives them a wide variety of resources and then a lot of information when meetings and things that are specific. Maybe you want to do ortho trauma. That's your thing. Just your wheelhouse, and you'll see things that are going to be advertised through the professional organizations and through NSA and in ASA and the ACS as well. So it's a great way to come involved and to network and to also receive a lot of information.
That's wonderful. Thank you. And my final question would be, I know this was primarily on the surgical first assistant program, but the question I would have about Meridian's associate degree for surgical assisting, is it only open to Meridian students, or can any certified surgical assistant apply
It's
for that?
for graduates of our certificate program.
Okay. So
Yeah.
just Meridian students. Okay.
Yeah.
Wonderful.
Yes.
Yeah, I took
So-
mine in 2017. I got my associate's degree in surgical assisting. And Kelly, you
Yeah.
got yours when? The same year, or was
I think
it
the same
earlier?
year. I think it was the first year they did it.
Yeah.
It was the first year they offered it. I did it. I think it
Yeah, I
was
had to wait to the
2016 or
second
17.
class, I think, of 2017 to get in. I think
Mhm.
November, maybe. I can't remember exactly, but that was wonderful. So, Kelly, are there
Yep.
any questions, or ladies, do you have anything you'd
I
like to
think
add before we
we've
go?
covered it. I'm tickled to
Well-
death we got all this information from y'all.
Me too.
I'm just, really excited that y'all are doing this. It's just exciting. And I think Candace, will probably say the same thing, is to see the growth in the industry, in the fact that there's more buy-in from facilities, and they're wanting to send their employees on to further their education and training, and the forethought and the recognition
Yes.
as first assistants, as mid-level. So that's really exciting. And two, I think that's just going to continue to grow. It's going to continue to grow. And even the Bureau of Labor Statistics, if you look at that, they did a 10-year projection from 2023 to 33 that it's like a 6% job growth rate, which is faster than average.
Wow.
So that's really exciting
Good.
too. So, it's not just
Encouraging.
us seeing the influx of students and the interest in the applications that are coming in for the program, but the fact that, the BLS recognizes that it's a faster job growth than average is exciting as well.
Good. Yes,
That
it
is
is
wonderful.
exciting. Awesome. All right. Well, we appreciate again you guys being here, you ladies being here with us.
Yes, thank you
And
so much.
again, representing Meridian Institute of Surgical Assisting in Nashville, Tennessee. And I would say, go ahead.
If you wouldn't mind, I would just say if anyone is interested and would like more information about our program, they can feel
Yes.
free to reach out to myself or to Candace. Can I say that, Candace? Candace doesn't want any more emails. She's got some emails. But they're more than welcome to reach out. It's shannon.smith@meridian-institute.edu. And I'll let Candace give her own.
I'm Candice.Spencer at meridian-institute.edu.
So-
It's the hyphen.
Yeah.
We say dash, but it's hyphen.
It's Candace.
Just
I
so you
notice it's Candace with an I, but John will put that information up on the screen when
Great.
we have this, and it'll be
Yes,
up
we'll
there
put it
for
in the
people to see.
description. Yep. So you
Yeah,
guys will have that
great.
since you give us
All
your permission
right.
to give that out. That's wonderful. We'll put Meridian's email or Meridian's web address up there as well. So,
Right.
will you guys be at either of you be at the conference in April?
Yes.
Oh,
Yes, we'll be
wonderful.
there in
Well,
April.
Kelly and I will
Yep.
be there, so we'll see
Yeah,
you then.
we'll see you there.
Awesome.
That's
Awesome.
wonderful.
In
Alright.
Dallas. That'd be
Yeah.
fun.
Yeah, we'll be there.
Great. Thank you so much.
All right. Thank you.
Thank you.
Next.
You have a good
Thank-
evening. Thank you.
You too.
Thank you for joining us today. We invite you to like, comment, and subscribe to our podcast. Feel free to look us up on Facebook at the Surgical Assistant Podcast. If you like, you can also email us at thesurgicalassistantpodcast@gmail.com. We look forward to seeing you on the next episode. Content of this podcast is created for surgical assistants and is educational only. It is not intended to diagnose, treat, or offer medical advice on surgical conditions. No patient-specific information is shared, and all HIPAA guidelines will be adhered to.